DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, thanks for joining us today on DocTalk. We're back at Kansas State University with my friend and colleague, Dr. AJ Tarpoff. We're going to talk about the calving process. We're going to talk about putting chains on, everything you need to know to help get that calf on the ground. Dr. Tarpoff's Calving School when we return.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Folks, welcome to DocTalk. I'm Dr. Dan Thomson here with Dr. AJ Tarpoff. He's a friend, colleague, incredible veterinarian, and he puts on calving schools through his position at Kansas State University as being our state's extension beef veterinarian. And this is like phase 2, right? Now we're going to talk about things that we need to do. We're into stage 2, literally, of the calving process, and we need to help mama get this calf out.
Right. So time frames, just to back up a little bit for everybody to be on the same page. She's gone through stage 1 of calving. That water bag is broken. After that water bag broke, we've got an hour. Right? She should be making progress. Looking at this in the field, you go out into the pasture, you're feeding, you're checking, you're getting numbers. You see one laying down, she's actively pushing. You don't have to mess with her right away. You can go finish the rest of your chores, go finish feeding. You come back, it's been 30, 45 minutes, and she's not making progress. Now it's time that we probably need to get her up, get her in, get an assessment, figure out what's going on.
Yep. So we get her up, we get her in. How do we get started?
Okay, so number 1, in my opinion,
I'm gonna just be newbie number 1, and I'm gonna ask the questions.
Restraint.
Okay.
Number 1, she's a big cow. This can be a dangerous scenario. Yep. We need to make sure that she is safe, we are safe, everybody's safe before we get started. We can restrain cows a lot of different ways. Something as simple as a rope. Roped a lot of cows out in a pasture, be able to get them tied to something. Whether it's a halter, you got her into a head catch, something to be able to restrain her. And in my opinion, proper restraint is something where that cow can stand up or lay down if she needs to, but she can't go forward and backward. So if you're going to cinch her up to something, make sure that she's cinched up close enough, whether it's a bumper, the back end of a side-by-side, something, the single tree out in the middle of a pasture, whatever that might be, that you have her cinched up enough where if she lays down, if she wants to, she's not going to choke herself. You can take that rope and put it back up over her nose, create a little halter out in the pasture. But I think proper restraint's number 1.
Yep. Gotcha. So then we're going to go to the business end.
So the business end, okay? So what should be coming through that birth canal? What we consider a normal birthing process, 3 things should be coming through that birth canal, okay? Yep. And I'll give you a hint. It's foot, and nose. Those 3 things are what we consider a normal calving process. So both of those front feet, think of a diver diving into a swimming pool. Okay?
Exactly.
Their shoulders come forward, they stretch forward, the head comes down in between. It's a nice small package to be able to fit through that birthing canal. That's what should be happening.
Yep.
So that's what we look for. If we get her up and getting a quick assessment, I always use lubricant, and I'll get a quick amount of lube on the inside of that birthing canal, but then I want to feel what's there. And this is where a lot of producers, a lot of students, a lot of folks have trouble taking this step on trying to paint a picture with your hands on what is in the birth canal, what is missing, what do we need to go find. Okay.
Exactly.
And so that's so if you can visualize, if you can reach in, and even if you see the nose, the ears, the eyes, we can kind of visualize what those should feel like. But then the feet kind of get confusing, right? Those feet, we can feel the different joints, we can feel the different feet, the hooves, but if one is missing, we kind of need some landmarks to work with. Personally, the landmark that I love to be able to figure out what leg is there, what's missing, is if there's one there, I will follow this leg down and use the armpit. Okay, I've been taught, and I've been worked with a lot of people that had different landmarks. The armpit, if one leg is facing out, if I find an armpit, okay,
and the other one's back,
if I find an armpit, I can always go across that chest and I can find that other arm. Okay, so the armpit of the one leg that's coming through is one landmark that has never lied to me.
Yep.
And for everybody, if you get confused by the joints, how they're bending, what you're feeling, don't fret. Okay, it's okay. Thankfully, we have a perfect example of the bovine anatomy standing right in front of us. I can't tell you how, folks, I can't tell you how many times I've taken a break, taken a deep breath, thought in my head what I'm feeling, and then look at mom and say, oh, I was grabbing the wrong leg.
Right.
Okay.
Yeah. Well, this is a perfect place to take a break.
Yep.
And when we come back, we'll talk about chain placement. We'll talk about the birthing process. We're here with Dr. Tarpoff at Kansas State University. Thanks for joining us.
Okay.
Hey folks, welcome to Cattle Intel by Neogen. And today we're talking again about biosecurity. And one of the big practices of biosecurity is introduction of new animals to your herd. If you have a closed herd and you're going to bring new animals in, it's best to isolate those animals and quarantine them for at least 30 days. The reason why we isolate and quarantine for 30 days is because most disease processes will be cleared within 30 days. If you want to use diagnostics to test for certain diseases like BVD, you can do that, which will speed the quarantine process up, allowing you to make herd introductions. But isolation and quarantine is a great practice for biosecurity. Thanks for joining us on Cattle Intel, sponsored by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
John McCurry with McCurry Angus Ranch. We are standing right now in our fall yearling bull pen. On our first initial run with therapies, we commingled 3 separate different pens of bulls together for the ones that's in the sale, and had virtually no issues with these cattle in terms of commingling them and their attitudes towards each other. Didn't have the riding and the fighting that we normally can experience. And I would highly recommend us using therapies, and would recommend that to anybody else looking to do so.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. AJ Tarpoff, and this is a little more of an action show than we typically do. So we're going to try to do more of these. But anyway, let's get started, Dr. Tarpoff.
Okay, so first things first, some of the tools and equipment. You know, we've previously talked about chains and straps. Whichever one you use, doesn't matter to me, but one thing that rings true is you need to use them appropriately.
Yep.
These chains, they're made a very specific way that they lock into place. They'll never get overly tight. And when we put them on correctly, you can pull me around this room and they're not going to hurt. They don't pinch. They're not going to hurt the calf. But we do need to be cognizant that if we use them incorrectly, there is a growth plate down on this lower leg that, you know, a leg could break.
Yep.
Okay. And that's what we're trying to protect against. So to make sure that we don't, one thing that we do is we put 2 points of contact before we really put these chains on and provide some pressure to be able to help that delivery. And when we put these chains on, to help visualize that, is number one, our first point of contact is going to be above that fetlock. The fetlock is that lowest big joint. And we put 1 point of contact there. And then the second point of contact is going to be below that joint. And all we do for that is just, you know, throw a half hitch into that chain.
Yep.
Where now we have 2 points of contact. We take the pressure away from that where that bone grows. Okay, so we're not going to damage the calf. We protect the joint, and now we have 2 points of contact that we're going to be able to appropriately pull this calf. Okay, so those are chains. Chains are probably the most commonly that are used out in the industry. The other kind of up and comer that folks are using a lot that seem to enjoy using out in the field are some of these nylon straps. Nothing fancy, just nylon straps with some metal rings to be able to slide. One thing that's different about these is we don't have 2 points of contact.
Right.
Okay, but we use these a little bit differently where we place them over that fetlock. And the difference is they will continue to get tighter. They don't lock into place, but when we use them, we pull and we release pressure. We pull, we immediately release pressure. So that's just kind of the key differences that we have with chains and straps.
Yep.
So now that we understand that, okay, we're going to use straps, we're going to use chains, we're going to put them on correctly. Now we get to that assessment side. We've already restrained the cow. We're on the back side of the cow. I get some lube and I might lube up a little bit. And what I see and what I'm seeing on the back side of the cow, wow, I don't have three things.
I got two.
I've got two. I've got a leg and I've got a nose, right? And I'm all about reducing stress, and nothing's more stressful than a calving that you begin with a leg on the outside and you push it back in, and all of a sudden you lose it.
Yep.
So anything that's out, don't be afraid to get a strap on.
Exactly.
Okay. Number two, I need to go find that other leg, and remember the point of contact or trying to find that area that I'm going to start with. It's the armpit. Okay.
Yep.
So I'm going to follow this leg. I'm going to follow this leg down the calf, okay, to be able to get to that armpit. And now I can actually figure out what leg is missing, where I need to go looking. And before I get too far, I don't know about everybody else, but my arm, the calf's leg, and the calf's head, that's too big to fit in the birth canal all at the same time.
Right.
And I know we're trying to deliver the calf and get it out. But sometimes the best way and the only way that we can make this happen is sometimes we have to push the calf back in to make a little bit of space.
Yep.
Okay?
Yep, absolutely.
So if you're going to do that, make sure that you don't injure yourself. You want to get enough leverage yourself. If you've ever seen your vet preg check, where they go in with a straight arm, they use their legs to be able to go in so they don't hurt themselves. Yep. That's what we're going to do to be able to help push this calf back in a little bit, just to make a little bit of space. We don't have to push them very far. It's not going to take very long, but we do get a hold of the head, get a hold of the chest. We're going to push this calf back in just to be able to make a little bit of space.
Yep.
Okay. So once we have that space, this is where usually somebody's going, okay, doc, well, if I push that calf back in, she pushes against me. Okay.
Yeah.
So behind you, Dr. Dan, I have a little trick. So this is a speculum. Okay, these speculums are what we use so we can tube cattle. You need a partner for this, and this is an old feedlot trick that I've learned, and it tried and true, but we can place the speculum in the cow's mouth, and a lot of times just having somebody up around the mama cow's head, she takes away her distraction, she stops pushing against you. Now that uterus will still contract, but she's not going to push against you.
Right.
If she continues to push, or if she's really straining, we can actually take a bloat tube. So just an actual bloat tube or a hose, and pass that all the way into the rumen to relieve, kind of like we're relieving a gas bloat.
Yep.
But whenever she goes to squeeze her abdomen and press her abdomen to increase pressure, it just releases air. So now she can't push against you. That uterus will still contract, but now we've bought some time to be able to do that.
Just remember that these go in the front end,
not the back.
Not the back end. I had one person on a colic, and they brought the horse and they'd put the tube in the wrong end. So
yeah, that's fair.
Front end. All right, so let's take a break. When we come back, more with Dr. Tarpoff on delivering the calf.
Plant the seeds of financial security today with United Patriot Coins Precious Metal Starter Pack, the Patriot Pack. Exclusive offer for our DocTalk family. Call now and secure your financial future. Strengthen your roots with silver and gold. Call United Patriot Coin today and ask for the DocTalk special offer.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrosin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrosin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrosin.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. AJ Tarpoff, and we're delivering a calf. And we've gone through everything, and now we're to the point where we're going to bring the calf out, correct?
We're going to do a quick correction. We're going to deliver this calf. We're going to get it on the ground.
All right.
Okay. So we've already made a little bit of space. We've got proper restraint. We've already put some lubricant all around on the inside of this, the birth canal, to make sure everything goes as slick as possible. Okay, we've made some space, but now I've got to go find. I've got to use my landmarks. I can trace back and go across the chest, get into that space and find that other armpit. Yeah. Once I find that armpit, I can start working it up. Okay, my goal is to be able to get the carpus, okay, the carpus of the calf, which is up here, yep, all the way up into the birth canal.
Yep.
Okay, and once I do that, I can reach down and actually get my hands around and get on top of those hooves. So those hooves are pretty sharp and they can actually tear the inside of the uterus. And we're trying to protect mama cow, yes, protect the calf all at the same time. Once I get my fingers on top of those hooves, it also gives me leverage to flex the fetlock, the carpus, the elbow, and the shoulder all at the same time. Okay. And once those all come up and through, now I have everything that I need coming out the backside of this cow. Where now I can properly place my other set of straps, and I can begin the birthing process. Now, you mentioned earlier about the calf jack.
Yes, sir.
Okay. This is a wonderful tool, especially if you're working by yourself or if you've got some shoulder problems, a bad back, kind of like me.
All the above.
All of the above. And what we do with this calf jack, okay, is we do want to make sure that the strap, it's made to fit with this butt plate.
Let me take this over.
Yep. Thank you, Dr. Dan.
Yes, sir.
So this is made to fit with the butt plate just below on the bottom side of this pelvis. Okay. This bottom side of the pelvis. And what we do is this is just a lever. Okay. It's made to give us a little bit of leverage. And we can slowly start working with her contractions. As she starts to push, we're going to build a little bit of pressure and work with her.
Yep.
Okay. We're not taking big bites or moving super fast. We're not pulling this calf. All we're doing is helping the delivery process. Okay.
Yep.
And notice the trajectory. I'm just coming straight out to be able to help pop those front legs forward. Okay. Yep. If it's a really big calf, you may want to try to twist it 90 degrees. I call it the half Nelson technique, so it doesn't get hip locked.
Yep.
And out comes the calf.
There we go.
Slow, methodical, making sure we're working with her, not against her. But that's how we're going to help deliver that calf as quickly and safely as possible.
Perfect. Well, we're going to take a break now that we have the calf on the ground, and we're going to go to work on the calf. We'll be right back.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idex.com/DocTalk.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here at Kansas State University with Dr. AJ Tarpoff, who is the State Extension Beef Veterinarian. Let's get right to it. The calf is here, the calf's on the ground. What are we gonna do?
Now, once this calf hits the ground, okay, first and foremost, this calf has to start breathing. Its lungs are completely collapsed. It's never breathed before. So there's no air, no fluid, nothing on the inside of their lungs. We want to make sure it's advantageous as possible for them to decrease kind of some of that pressure, be able to breathe and flex their diaphragm for the first time, and open up those lungs for the first time. So when I get a calf out onto the ground, I kind of do what Mother Nature does. I do what Mama Cow does, except I have to step in for this because I help deliver. I get this calf on the ground and I get it sternal. I don't need to pick it up upside down. I don't need to swing it around. I want to get it on its sternum, on its chest, hold its head upright, clean out its mouth, clean out its nostrils, make sure there's no fetal membranes, and I start the rubbing. Okay, sometimes I carry a beach towel in my calving kit that I'll start rubbing. I'm moving, I'm manipulating this calf. It's that neural stimulation that tells the brain it's go time.
Yep.
It's time to start breathing. If that doesn't work right off, if you find a piece of straw hanging around, you can tickle the inside of the nose.
No.
And if you, and if you've ever had a feather or something stuck up your nose, you get to sneezing, that's stimulation. One quick stimuli you can do if you don't have a piece of straw is you can squeeze the inside of the nostrils. Okay, just on the inside, the hard cartilage, you can squeeze it. And usually a hard squeeze, 1, 2, 3. That's enough to be able to stimulate that calf and get it to start breathing. Once it starts breathing, many times we may have to tube a calf, okay, to get that critical colostrum that I know Dr. Dan's talked about. But tubing in itself is sometimes a struggle for some folks. Okay, so I like to share some tidbits with people, especially if they're not super comfortable, making sure that we can tube this so it goes down the right pipe so they don't drown.
Yep.
Okay. One thing I do is this ball on the end of a tube. Okay, it doesn't matter what type of tube that you use, they have these balls on the end. Those are called bolus balls, believe it or not. And we want to place this bolus ball in the back of the throat and allow the calf to swallow. Okay, even a premature calf, if that's an involuntary reflex, they are going to swallow.
Yep.
So for new folks, I'll even take a magic marker and I'll measure out from the tip of the nose to the corner of the jaw.
Yep.
Okay, and I'll make a mark. And what I do, and why I make that note, is I will place that's the back of the larynx. That's the throat. I'll place that ball in the back of the throat. I'll hold this head upright, and I wait for that calf to swallow. And it might be delayed by a couple of seconds, but it will swallow. Once that calf swallows, that's when I can advance that tube.
Yep.
Now, the second most important step to verify we're in the right spot, okay? The esophagus, or the tube that goes down into the stomach, runs on the left side of the calf's neck. Not our left side, but the calf's left side, however you're standing, okay? But we can actually, on this left side, we can move that tube up and down, and we will see it just underneath the skin. And we can see it, we can feel it, we can manipulate it, or we know for sure that it's on the left side of that neck, okay, going down, and we can feel it, see it, guarantee that it's in the right place. Then we can start putting some of that fluid down.
Perfect. Great information, great series of shows. Thank you for all you do for so many people.
Yep.
And thank you for watching DocTalk. Remember, if you want to find us, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thomson with Dr. AJ Tarpoff here at Kansas State University, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.